friends, this is Dr. Sitesh Roy, your allergist, immunologist and asthma specialist, coming to you with this special on the time for transmission of SARS CoV2 viruses from surfaces or fomites. I get asked this question all the time by my patients, by family, friends and a lot of other people, that is it true that SARS-CoV-2 can survive on surfaces for long periods of time? So initially it was thought for 3 or 4 days, but now maybe longer. So the truth is, a very good research done in Australia has finally laid these questions to rest. They looked at 2 factors. One was the relative humidity and the other was temperature, and then looked at survival of this virus on a variety of different surfaces. And what were their findings? At 20 degrees Celsius, SARS-CoV-2 virus on surfaces like metals, glass that might be present on our mobile phones, ATMs, public kiosks and other places, and also on what is called polymer banknotes, can survive for up to 28 days. That's right, you heard it right, 28 days. And when you look at surfaces like a porous material like cotton, the survival was about 14 days. And what was found is that as the relative humidity increased, the survival went down. And as the temperature went up to 30 degrees Celsius, the survival time of these viruses on plastic, glass, metal, and again non-polymer banknotes went down to about 7 days. And on surfaces like porous material, cloth, cotton, the survival went down to 3 days. And when the temperature went up to 40 degrees Celsius, which is not uncommon in many of the tropical countries, this survival went down even further to 48 hours for surfaces like plastics, metals, glass, and for surfaces like porous material cotton, the survival went down to just 24 hours. In all of this, what we have to realize is we do have to be careful about where we are touching, because it's not just the presence of the virus there, but for the virus to go from the touched surface to our nose, eyes or mouth, it's our fingers that carry the virus. And so the key is hand washing for 20 seconds very thoroughly, taking all the surfaces, or hand sanitizing very thoroughly if we touch any surfaces that are used by people who are potentially infected, unknown people and known people if there is someone infected in the home. The second thing that's very important is in sunlight, the SARS-CoV-2 virus is very rapidly inactivated, and because of that, the virus does not survive for hardly even a couple of minutes or hours when there is direct sunlight falling on that area. And so cross ventilation, air movement, sunlight seem to be great ways to sanitize our homes, if I may say it, but also using actual cleansers, surface cleanser, using sanitizers, using potentially other forms of cleaning becomes equally important. When the survival of SARS-CoV-2 is seen on food materials, fresh foods that are not frozen tend to have a shorter survival span than foods that are kept in freezing conditions, because it has been found that once the temperature drops below 13 degrees Celsius, the virus can survive even up to 60 days on a surface where it has dropped through someone sneezing, coughing or touching after touching their infected parts of the body. And so with that, friends, we do have to be careful. We have to take care of ourselves. We have to maintain our physical distance. We need to wear our face masks, because cutting down the viral inoculum through the airborne or aerosol system is a great way to reduce the chance of infection or the severity of infection. And certainly we need to take care of all these things that come into our homes with the right cleaning and precautionary mechanisms. With that, take care, stay safe till next time. God bless us all.